Hello, this is Dr. Troy, the chiropractor for babies, and your babies, and my babies. Anyway, people always ask me, is chiropractic safe for children? And how old do they have to be to get them adjusted? Well, I'll tell you, all three of my kids were born at home, and they were adjusted within 2 minutes of being born. I was a little slow on my son. I got to him 2 minutes, but my daughters, they were both adjusted within a minute of being born. And you ask, how can you adjust a baby? Their bones are so fragile and tiny. But the reality is the nerve system is protected by spinal joints. And yeah, they're smaller and they're not fully developed, but they can still have misalignment, especially from the birth process. Depending on how long mom's in labor or the complications with pregnancy, they can have spinal malfunction and nerve system disturbance early in life. From womb to tomb, I say you can get adjusted, or from the basket to the casket. But little babies, let me tell you some of the things that we've seen with babies. One thing we've seen is colic. Very common to see babies with colic. They're screaming, they're crying, they don't want to eat, they're fussy, they won't breastfeed, they won't take a bottle. The research has shown that within 2 weeks, listen to this, 2 weeks, 97% resolution of colic. I can't tell you how many babies I've seen who have been adjusted, and within 1, 2, 3, 4, 5 visits, their colic disappears. What else can we see with babies? We can see allergy issues. We can see constipation with infants, just newborns. They'll be constipated. They'll be bloated. So that's one of the things I always ask the parents, is the baby having bowel movements? There's certain maneuvers you can do to help stimulate the bowels through the nerve system. Sinus issues, if the baby's not eating, they're not sleeping, these are all signs that they could have stress and tension on their nerve system, which chiropractic has proven and shown to help in many cases. So what do we do for babies? Well, there's a couple things we do. One, we do an examination. There's a couple different techniques that we use for adjusting children. It's very light force. You're putting maybe just a light tapping, and a lot of times you won't hear any noise. Sometimes we'll use an instrument. We'll use an activator type of instrument where it just puts a light, gentle pressure on the spine. Just depends on what's going on with the child and what's needed. And then there's some other manual techniques that we use, like massaging the bowels, the stomach, to get the bowels moving in a junction to doing the adjustment so that the body can work better. So if you have a baby, you know somebody with a baby who's suffering, that's usually why they come in. Ear infections, there's another one that's huge. We'll see ear infections big time, because the typical approach is to put them on antibiotics, which there's a lot of information out there that says that might not be the best approach. Dr. Scott Mendelson, who said How to Raise a Kid in Spite of Your Medical Doctor, wrote a book, and in there it said first thing you should do if your child has an ear infection, take them to a chiropractor. How that works is the upper cervical area neurologically innervates the eustachian tube, which goes from your middle ear into the back of your throat. If that tube gets clogged, which could be from a nerve disturbance, then that's where this ear infection stuff occurs. So we've seen great results with ear infections, sinus problems, even breathing problems. So if you know someone suffering, your baby suffering, call our office. This is Dr. Troy, the chiropractor for babies in Vancouver. Free consultation, 360-260-6903.